A very common condition to young mothers, they see a baby, and they think one eye isn't focusing with the other eye. It's a little bit off to the side. And what is that thing called? Lazy eye or something like that?
Well, actually, most people call it a lazy eye, but that's not actually the correct term. It can either be a crossing eye or a wandering out eye. A lazy eye actually refers to when one eye doesn't see as well as the other, and that can be caused by the eye wandering, but it could also be caused by a lot of other things. But when you have the eye wandering out or turning in, the medical term is strabismus for that. But when the eye is crossing in or wandering out, that should be evaluated by a pediatric ophthalmologist in order to make sure that there isn't any condition that either needs to be treated with glasses, with surgery, or if there is a lazy eye caused from it, meaning that one eye doesn't see as well, you also may need to be treated with patches. And that involves patching the better seeing eye in order to force the child to use the worse seeing eye in order to strengthen the vision in that eye.
If surgery has to be done, when is it usually considered?
Surgery is usually considered any time after 6 months of age if it's needed. Probably it should be done within the first year when the eyes are crossing or wandering out, and probably the sooner the better.
What's this term, amblyopia? What's that mean?
Well, amblyopia is what I was referring to as lazy eye. That is when one eye becomes lazy because the brain has decided to focus on one eye instead of the other eye. It could also be caused when both eyes don't have good vision, such as if somebody was born with cataracts or somebody needed glasses and never got the glasses that they needed. They could cause both eyes to be lazy. And the treatments with each of them have to do with, first, if there is something blocking the vision, to clear it out of the way. If they need glasses, to get the child in glasses. And if there's an imbalance between the two eyes, then sometimes a patch is needed to patch the better seeing eye in order to make the worse seeing eye see better.
There's a thing called pseudo